First, we're going to talk about the new variant that people have been hearing a lot about, the BA.2.86. What do we know about this variant?
So still learning a lot about it. Certainly it seems to have a lot of mutations compared to ones that have been out before, but we know that it is a descendant, I guess, so to speak, of Omicron, much as most of the variants at this point have been. So there's some new evidence coming out to suggest that it may not be quite the issue that we thought it might be, and so it may not be quite as infectious or able to evade the immune system, although that was a concern in the beginning. So we are seeing it spreading a little bit in the country for sure, and as with most of these things, I expect it will increase until there's an equilibrium of some type. So.
Yeah, speaking of that, there have been reports about a rise in cases and positive cases across the country. What are things looking like right now in Newfoundland and Labrador in terms of case counts?
Yeah, so we're certainly, I think that rise is reflected here as well, and we are seeing a slight uptick in cases, but certainly not anything that's of major concern at this point, and not really even as high as what we saw in the spring, say. So our hospitalizations have been holding pretty steady. So, not unexpected given what's happening elsewhere in the country.
Now, going on to the booster, one of the ways that we're told to protect ourselves against COVID-19, what's the plan for the booster rollout this coming fall?
We're still waiting to find out what exactly what boosters are going to get approved by Health Canada, so we're still waiting on that, and hopefully that won't be too long. But once we get that information, then we will have more be able to, I guess, more definitively talk about the booster program. But what we know right now is that our flu vaccine program, hopefully we're starting that sort of mid-October. That's generally when we start that. We hope to be able to roll the COVID vaccine program out with the flu vaccine program. So it'll probably be mid-October-ish. We certainly would encourage people, once we announce that fall campaign, we would encourage people to get their vaccination.